Welcome back to K24 Alpha Jury. Before the commercial break, we were talking about kidney failure and kidney transplant. Right about now, we're about to go live on Skype with Gary Wainaina, who's been actually undergoing treatment for his kidney failure. And if you could just have Gary right about now. Good morning, Gary.
Good morning. Hi, Sarah.
Hi, how are you?
I'm good. Long time.
Long time. It's been a minute. How is it going?
The thing is good. God is good on my side.
Yeah.
And I cannot complain.
Okay. How is wifey and the little girl?
They are all good. My child now has joined like a small school over here, so she is getting to interact with other kids, which she was not used to. She only knows how to talk to adults.
Oh, that's amazing.
With her lungs.
Yes, and I'm so happy to see you after such a long time.
Yeah, it's been a long while, and it's nice to connect again on this platform.
Absolutely. So, so you're actually live on air, and I'm here with.
Oh, okay.
Yes, and I'm here with Dr. Murthy.
Okay.
Yes,
I'm happy to hear that he's from Eldoret. I come also from Eldoret. That's my hometown.
Oh,
and
yes.
The doctor, yeah. The nephrologist that is dealing with me here is also from India.
Oh, wow. That's amazing. So, Gary, I'm sorry? If we could just get right into it, yeah?
Yeah.
Yeah, please just tell us about your journey. What happened? How did you find out that you had a kidney failure?
Okay. I came here in the US last year in September, and I wanted to join. I'm a musician. Back in home, I was a musician, renowned musician. So I wanted to continue with that journey here in America to become a musician in the Air Force. So I went on and did the training for the Air Force and went for the check. That's when you see the injection that we normally have as Kenyans here, it translates here as you have TB, tuberculosis, latent TB. So I was disqualified. And so I went to the hospital later to treat, because I cannot be employed if you have TB here, because TB is a big thing here. So I had to take medication, and medication and therapy takes 6 months or sometimes 9 months. So before then, they say that they have to check my kidneys to see if it works, because the medication for TB is very strong. It needs working kidneys so that they can take out the things from the blood. So they checked my kidneys, and unfortunately, that's when they realized that they are not functioning well. They were operating at 9%. Oh. And in fact, dialysis is supposed to start at 15%. When you are at 15%, you're supposed to start dialysis, which I had no idea. I didn't have any symptoms. So it was just a shock in my family. We went through a very terrible season at that time, and we were so low at that time because it's a big blow for me and my family. And in a journey since December, I've been undergoing a lot of checks, a lot of blood draws, a lot of things, and they've been checking me a lot every month. I'm called to do. So I did a biopsy. They confirmed that I have interstitial nephritis, which is inflammation of the kidney, and that left kidneys they had failed. So they decided to do dialysis on me. So I'm on dialysis right now. And later, I'll demonstrate for you how I do my dialysis. It's called peritoneal dialysis, and which is not common. Most people, the hemodialysis, which you become an inpatient. Yeah. You go to the hospital for 4 hours, 3 times a day, which here they take you through a process of training. I was trained for 1 week about the kidney disease. So here the training is it's so thorough, and you get to be trained as in
for you to understand.
For you to understand, and all the options, it's you to decide which option you want. The doctor does not say that you do this. They give you all the options. I have books here. I'm not a person who reads a lot, but I have a lot of books here, which are for kidney dialysis. I have books here, materials which have been given because my dialysis, I do it at home. I need to take care of my body. I was operated. I was put a catheter in my stomach. Right now, I have a catheter in my stomach, which I used to do the dialysis. I will demonstrate that later.
Yeah.
Right later on the show. Yeah.
Okay.
How I do it.
Okay. Did the doctor tell you the cause of your kidney failure?
The inflammation is what caused my kidneys to fail. So I was given steroids. I took steroids for like 3 months to see if they will work again. But unfortunately, they didn't. When I went, because I normally go every month for checkup, they told me it's at 5%, and I really need to go to dialysis. That's when I started dialysis. But they told me something that either started from Africa, the disease that maybe started in Africa or something, because they started looking in Kenya, the map of Kenya, if the disease is around that area where I come from. So, but they don't know exactly where it came from. But it looks like I've been having this disease since maybe when I was little, because my body didn't feel any pain or anything. I was just fine. I was just the normal me. But sometimes my energy was low, but I didn't realize that it's kidney that is causing all this.
Okay. So what kind of treatments are you undergoing? Because I do remember we were having this conversation yesterday, and you said that you are waiting for a kidney transplant, which you're not so sure when that is going to happen.
Yeah. So here, in fact, when you are now on you're having kidney failure, it's not given that you'll do a transplant. They have to take also a lot of checks to see if you're. They don't want, because it's a very big process. They don't want to waste their kidney or a donor's organ. So they want to really know that you are a good person to give the donation to. So they check if you're a smoker, if you take too much alcohol, that. So they don't want to put in your kidney, then they do another transplant again in a few years. So they want to, because I have a friend of mine who is here and they've not done a transplant yet for him. So they have to take your name in a list. So, and here it takes 5 years before a donor. They put you in a list for 5 years, you can stay for 5 years.
Wow. Before
you get on top of the list.
Okay.
So that's why you have to look for a living donor, which I've not found yet.
Yeah.
You look for otherwise you'll stay for 5 years before your name comes to the top of the list.
Okay. And just maybe if I can just ask you how this has changed your life since the doctor told you that you have kidney failure. How has it changed you as an individual?
A lot of things, because a lot of things have changed, especially how I eat. Recently, before I started dialysis, I changed how I eat. You are not supposed to eat potassium. You're not supposed to eat things like potassium and what else? What else was I?
Red meat.
Red meat.
I'm forgetting the other one. But a lot of things will change. Especially eating programs, and then now that I'm on dialysis, I'm also changing because I do dialysis 4 times a day. So this one, I have to every time 20 minutes to change the fluid that I have. Right now I have a fluid on my stomach. That's what takes in the toxins in my blood, that through osmosis or diffusion. That's what takes. So I have to change after 4 to 6 hours, I change that solution, which is a big thing. You have to change a lot. You have to be programmed now.
Okay.
It's not like I can live a normal life now.
All right. And before I let you go, maybe, Gary, you can just tell us what you think is the biggest difference between the way we are treating kidney failure here in Kenya as compared to there in the States. And what you think we should actually import from there.
First of all is information. They say information is power. A lot of people have no information about kidney and kidney failure. Like here, people get a lot of information about their health, and at home is something that we need to also venture into that, giving people information.
Yeah.
And the government also should do a lot to have materials for people to read. I know we don't a lot, but even just small clips for people to understand what kidney failure is, and also understand dialysis, the process of dialysis, because most people think that this process is like, most people don't understand when I talk about dialysis. So the government needs to invest in information, getting the information out, because I know a lot of people who suffer from kidney, but they don't know, their family do not know how to take care of them.
All right.
Yeah.
Thank you. Thank you very much, Gary, for taking time to talk to us right here on K24 Alpha Jiri. We shall be keeping up with you. But as of now, we go back to our discussion. We will come back to you just to follow up on your progress. But even, Dr. even as you can hear, he has told us his story. And I don't know what you make about his particular condition.
So let me start by saying, see, this is the typical story of a kidney patient. The typical story of a kidney patient across the world, irrespective of whether he is in Africa or America or any other country. See, look at what he has told. He was doing well, absolutely well, when he was back in Kenya. And that he went to US to find a job placement. And then during his routine checks, that he was found to have the kidney disease. And that too fairly advanced enough to the extent that it requires the renal replacement therapy, what we call as renal replacement. That is a substitute kidney. Substitution for the kidney function is so bad, it is less than 10%, or technically it is so to say, requiring dialysis means less than 15%. So low, he was asymptomatic, no symptoms till the disease was so advanced to require either a dialysis or a transplant program. See, this is what exactly one particular thing is the peculiarity of kidney disease. Or so to say, any disease, when it is slow and smoldering, it doesn't produce many great symptoms, like blood pressure. Your blood pressure is 140/90. That is starting of a blood pressure, but you never have a symptom for it. But unless it is checked, like blood diabetes, when you have 130 or 126 fasting and about more than 200 in the after food, 2 hours after food, you are a diabetic. But it is unlikely that you will have any symptom because of that. Similarly, kidney disease, when it starts, when the kidney function, which is normally it should be around above 100 and up to 120 in a young adult, unless it falls to less than 30%, it does not produce any symptom. That too, when the process is chronic, so to say, the rate of progression of loss of function is so slow, say at the rate of say 2 to 3% per year. And for him, for example, it has taken maybe 15-20 years.
Absolutely, yeah.
For the diagnosis that he was told to have is an inflammation in the kidney, interstitial nephritis. The story looks like he might be having the disease from birth. But usually not birth means it is a genetic disease many times. So interstitial diseases of the kidney are very slow to progress. They start around somewhere time of adolescence. Not exactly birth time to say that it is adolescence. And by the time they reach a young adult or a middle life, they start failing. And it is the symptoms of failure that you recognize, not the symptoms of the disease. You got it?
Which is unfortunate.
So you get malaria, you get fever.
Yes.
Isn't it?
Yes.
But now here, the symptoms, if at all somebody develops, they are the symptoms of failure. Like you can't eat, you can't pass enough urine, the body becomes bloated up. These are all signs of failure. You are vomiting incessantly, you are becoming drowsy, you are becoming weak, your bones become weak. Now, this is all symptoms of kidney failure. But the disease is different. In the diseases, for example, all over the world, the commonest causes of kidney failure are again the same thing that affect us in our daily lives, like blood pressure, high blood pressure and high blood glucose and high cholesterol. These are the common causes across the world with differences, little bit differences somewhere here and there, say. So these symptoms are related to those diseases if they are uncontrolled.
Yeah.
Like a very high blood pressure should make your have headaches, make you vomit, get a paralysis, do something like that.
Yeah.
Or a high blood glucose makes a lot of urine for it, you get infections for it.
Yeah, yeah. Now, which means by the time the disease is discovered, most of the time it's a bit way too advanced, right? Okay, and you are a nephrologist, Dr. Ari, and maybe if you can just start by telling us the importance of the kidney and the role of the kidney in our body.
See, basically, people tend to be more afraid of kidney disease. Somebody says, I'm having a heart disease, he's not really afraid. I watch in my last 20, 25 years of clinical experience. People simply say, Doc, I have blood pressure and I have breathless, and I went to the doc and he referred me cardiologist. They did an angio and put a stent. So the whole thing he narrates with not much of pain and suffering, like this man who was going through the pain, a life-changing pain.
Yes, yes.
So the reason is the same again, the slowness of the disease. Not all kidney diseases are slow to say. Some diseases of the kidney, like this is common for all organs, not just kidney. A heart attack is very, like it comes like lightning, isn't it?
Yeah.
It can also be silent, but many times it strikes you.
It
just strikes. You can't miss it.
Yeah, but what's the role of the kidney?
So, see, simply, like the heart pumps blood, the lungs breathe, give you air and oxygen. The kidney simply cleans blood. That is the first and foremost function. You take water, you take fluids, you take food, everything enters into the body, and the body needs to clean it up. So, and whatever, all the metabolism, the end products, so they are to be generated and thrown out to the body.
Absolutely.
That is the fundamental and the first function of the kidney, to clean the body.
Yes.
That is not it where it stops. Now, that is where I would like to tell people.
Okay.
Now, yeah, that is very, very important to know that it is just not about a cleaning system. It also makes your blood. Now, that is where the difference comes. If your kidneys are not functioning, people simply think that, okay, I am dialyzing and the kidney, the machine is supporting and the machine is cleaning. But what are the other functions of the kidney? It helps you to make blood. It produces the hormone called erythropoietin, which makes blood. And when kidney is diseased, not only does it clean, it doesn't produce the hormone necessary for your blood to form in your bone marrow. So any patient with a kidney disease, you can see they will be on injections, the erythropoietin injections like your insulin for diabetes, the erythropoietin injections they have to take weekly pokes just to keep up their blood hemoglobin.
High.
Yeah, high, 10 plus, around 10 or 10 plus they have to keep. Then only they will be having some energy to work. Or they won't feel, otherwise they feel weak and they will not be able to work, they will not be able to concentrate. So that is one part of it. Now there is again another very important function which most of the people or even doctors fail to recognize. Now people, okay, they have the right to be innocent because we need to educate them.
Absolutely.
It is doctors also should realize. When the kidney fails, it fails to synthesize vitamin D, the most important thing that is necessary for your bone health. Your bones become weak, they break. Now, that is how actually kidney disease come indirectly to our notice. A patient's kidney is sick. So maybe it is around 30-40% or 20-30%, but not enough to cause complete kidney failure, but enough to cause your bones to become weak and enough to cause your hemoglobin to fall. Now, this patient continuously complains of weakness and bone pains, nothing else. Now, these are usually treated as non-specific. At the most, he will get a vitamin or iron supplement or a calcium supplement from his GP. If the GP is not very alert to this possibility of a kidney disease. Otherwise, an alert family physician is the first one who should have a suspicion. hey, why this patient's hemoglobin is not improving when I am giving him his iron supplement or vitamin supplement, whatever it is, B12, folic acid, whatever hematonics is getting, then he should have a suspicion this could as well be a kidney disease. And another thing, why in the first place the bone pains and why did it break in the first place when he just, patient falls, a 60-year-old just triples over a small step and then breaks a bone, he should have a suspicion. This degree of trauma should not break a bone unless it is sick. Now, this is awareness of the GP. I'm trying to drive at this point. Awareness of your family physician. Now, at this point, the kidney disease is not far so advanced to require dialysis, but advanced enough to make your bones and blood sick. Not only it stops there, there is another point which most of the even medical fraternity is not recognizing. It not only, the kidney disease usually affects not only the blood, the bones, the lungs, every system, including the heart.
Wow.
So, if a patient has a hypertension and diabetes and a kidney disease, and an early kidney disease of 40–60%, before he goes into early complete kidney failure, he is more likely to go to heart disease first. Yeah, he's more likely to break a bone. He's more likely to have a heart attack first. So by the time he reaches kidney failure, he already has a heart disease.
Absolutely.
So I am trying to say that early detection prevents not only kidney disease, progression to other organs is important. And evaluation of all the organ systems is very, very important. So an early referral by and an early awareness of the family physicians. Indirectly, we are the people, nephrologists, who are to teach them, teach the GP, teach the family physician, teach the internal medicine guy. Hey, these are the clinical signs, early signs, which the patient will not be aware, but you are supposed to pick it up. If somebody like Mr. Gere has a disease, screen the family members for genetic diseases. The other members of the family, his brothers, his sisters, or his cousins, maybe they may be having early disease. That is the point where early detection comes in. Now, they also will not have symptoms. See, it is the first family physician who is properly educated by a tertiary care people like us. They should try to pick up the disease. Then only you can pick it up early.
So there are two classifications of renal failure, which is the acute renal failure and the chronic renal failure. Please just give us the difference between the two and how the two can be detected.
See, I told you, in medicine, all the diseases follow a temporal pattern. Any disease can come suddenly, or the same disease can become usually chronic. Usually, acute diseases, just like giving an example of heart disease, heart attack. When the blood supply to the heart is blocked suddenly, you get suddenly the pain, we call as myocardial infarction in medical terms, simply a heart attack in layman terms. But the same block is slow and persistent in multiple areas. He will simply land up with failure. See, the initial things, the pain part may have gone. So a chronic process is not going to give you symptoms, like this case, but an acute process, for example, in the kidney. Now, we are talking of kidney. Let us come back. I'm just giving an example of other organs. I'm just giving an organ. Every organ suffers like this. So the disease processes, depending on the cause that incites it, can come stormingly, like a bolt in the blue, like acute kidney failure. Like, for example, here I have seen very common malaria is one thing. In one month itself, so many cases of malaria I have seen. Or even a simple acute kidney failure, the simplest causes are sudden loss of fluid from the body. Rapid loss, sudden or rapid loss, simple, diarrhea. Even a child is susceptible. A child is susceptible. When somebody unhygienic conditions are enough to create severe fluid loss, the kidney fails. This is a treatable failure. Yes, it fails, but treatable. So the good part of it is acute problems are stormy. They are also land up in failures, but they're treatable. They're treatable.
And real quick, because of time, as we talk about the treatments out there, what options do we have for kidney failure?
Now, see, now that keeping aside acute one, see, when an organ fails, we support it, whether acute or chronic. A person has a severe asthma, it's a very common complaint. He also requires a respiratory support, a ventilator. Patient with a severe pneumonia in the lungs, he also will not be able to breathe. He will require temporary ventilatory support. So any organ system, particularly the kidneys, if they don't work, that work is done by the machine. That is dialysis, either in the acute setting or in the chronic setting.
Chronic, yeah.
Now that we are more focusing on chronic setting,
Yeah.
so dialysis is done for both acute and chronic. The only difference is you cure the acute condition, say diarrhea is cured, your kidney failure is cured, no more dialysis. Or your malaria is cured, your kidney is cured, no more dialysis. But the chronic setting like this patient, the disease is chronic and has produced a permanent irreversible damage.
Wow.
Now this is where you require dialysis either for a long term or you go for a transplant.
Okay.
Now I mean, so you need a organ replacement.
Yeah.
This we call as,
Yeah.
in technical terms, renal replacement. There are 3 pathways here for chronic failure.
Yeah. Real
What-
quick because of time, please.
Yeah,
Yes.
yeah. Like this man is undergoing peritoneal dialysis, or the other one conventional, everybody knows it, hemodialysis, that is.
Okay.
The third line is the transplant.
Okay.
We go for a transplant if you have a suitable donor, blood matching, and a tissue matching donor from your own family. Or like this man is waiting for his cadaver list, like what we call the patients who are dying,
Okay.
and they donate their organs.
All right. So how can people get in touch with you? Because I'm sure there's so many people out there who really want to get consultation from you and just know
Yeah,
how
why
to
not?
go
They can
about
call me Dr. A.S. Murthy, Medihill Hospitals.
Okay.
Yeah.
All right.
Eldoret.
Eldoret.
Yeah, I'm placed at Eldoret.
Sawa. Thank you very much for
Thank
coming
you.
through.
Thank you.
Please enjoy Kenya, and we are so happy of the good job that you're doing.
Thank you.
All right, and that's it for Wellness Wednesday. We shall now take a short commercial break, and then when we come back, as we promised you, Chronics is in the building. You do not want to miss this interview, so don't go anywhere.